8:38. Let's go to the Gateway News Zoom room where Hospital Administrator Lillian Posadas is standing by. Good morning, Lillian.
Good morning, everybody. Good morning.
Good morning.
Okay, so I guess our first, we'll just jump right into it as we always do. That's what I love about you. The JIC said 17 hospitalizations. Public Health Situation Report says 24. Where are we with the hospitalizations at GMH?
Well, as of this morning at 6 o'clock, we have 23 in the house. Four of them are in the Care 2, which is our designated ICU COVID unit. Um, and then 17 are in our Care 4 COVID unit. That's in the third floor medical telemetry unit. We have phased out Care 3 and moved the COVID patients who are not ICU into Care 4, which is our third floor. We have 17 individuals in that unit. And then there are two additional COVID patients who are ICU level of care in the ER waiting to get into a bed in the either ICU Care 2. So fortunately, the two individuals waiting in the emergency room, they are ICU level of care because of the vasopressor medications that they are on and supplemental oxygen. They are not on ventilator support. They are not intubated, but they are receiving supplemental oxygen, either through regular nasal cannula or high flow nasal cannula oxygen. And so, I just want to emphasize that the patients that we are seeing, the individuals we are seeing in the hospital, are no longer the elderly individuals. They are in the young group. So the age ranges from the early 30s. We've had some 18-year-olds and some 20-year-olds. We even had a 7-year-old that was seen in the emergency room throughout the weekend. So, the mindset of people that, oh, it only attacks the elderly with the comorbidities, that's no longer the case. That's no longer true. This virus attacks any human host. Regardless of the age, regardless of your ethnicity, regardless of your class status, or even if you're a professional, you're a human host for this virus. So it latches on to your blood, to your cells, to your tissues, and it attacks your lungs, your respiratory system primarily.
Lillian,
And
I
so
guess
that's why.
right off the bat, can you tell us more about the 7-year-old? Because that's alarming, and Bree has broke down some of the data we had since Friday.
Right. So 0 to 9 years old, 14 new cases. This is from Friday to yesterday. 10 to 19, 17 new cases. 20 to 29, 33 new cases, and then 30 to 39, 28 new cases. So you're right. It is a lot of younger people are getting
Correct.
sick and getting infected with this virus, and it really is alarming too, and just really sad when you hear a 7-year-old.
Yeah.
So obviously it's within households, within families.
Correct.
Can you
And,
just tell us about that
parents
7-year-old? Because
have
I have
to.
a 7-year-old, Lillian, and I'm wondering, and I know a lot of people out there have young kids. When a 7-year-old goes to the hospital for COVID, what what happened? And if you could give us the details of this case.
Well, depending on the symptoms of the unfortunately for the 7-year-old, he did not the individual did not have to be hospitalized. The parents were also seen because they were both COVID positive, and they're in their 30s, and so the parents and the child came in. Unfortunately, they did not have to be hospitalized. They were discharged home on home isolation, and so primarily the symptoms would be fever, even sometimes just nausea and abdominal pain and diarrhea. So for this particular 7-year-old, I don't remember the symptoms, but fortunately, the individual did not have symptoms severe enough to require hospitalization. They were able to be discharged home into a home isolation. I've even heard of cases of a 7-month-old child COVID positive. So yes, it is really affecting the younger population, and it may be that it's all this social gathering that we've gotten kind of laid back because we were in peak or three. We were gathering and doing some celebrations. Unfortunately, the results have come out to be that, there's an increase, a really severe, significant increase in the cases that are then COVID positive.
Lillian, real quickly, the Care 4 unit, I know we talked about this last week. Do they also provide ICU level of care?
It can be the beds, and the rooms were structured physically when we started the progressive care unit. That's a level between telemetry and ICU. And so those beds, those rooms can accommodate patients who need a higher level of care, such as ICU. And if the patient is on a ventilator, there's room enough in there to then, accommodate that ventilator to support that individual who requires to be on a ventilator support.
So
So,
then is
yes.
ICU, so then is the Care 4 unit full because you have two ICU level of care patients in the emergency room?
Right. But see, the other issue here is staffing. We're using all our critical care ICU nurses wherever we need them. And so in the emergency room, we're keeping them there. They're not on ventilator support, but they are on medications that, will sustain their blood pressure. And so the emergency room nurses, they're critical care nurses, so they can manage the care of those two ICU patients until we get more staffing to bring up to Care 4. And adequately and safely staff that area for
Are,
those patients.
are any of the 17 in Care 4 receiving ICU level of care?
No, not right now.
Because of
They're
the staffing.
primarily they're telemetry patients and also progressive care unit
How are you
individual.
separating these two COVID cases in the ER that are receiving the ICU level of care from just the regular patients that are coming into the emergency room?
Absolutely, we're using the isolation rooms.
Okay. And how many beds are in the ER?
It is structured to have 20 stations, and that includes two trauma rooms, one or two suture rooms. But in terms of the capability for monitoring, central cardiac monitoring system that we can then put patients on, there are 14 beds with the cardiac telemetry capacity.
Is the ER full?
Right now, you know what? I did not get the full census of the emergency room. Hold on, let me take a look at the nursing supervisor's message as far as how many patients are in the emergency room. Right now, we're not on divert.
Okay.
When we go into divert, it's because the ER is saturated. So I haven't heard that we are on divert. So we may have a few more beds open and available
Were you guys
in the
on
emergency.
divert yesterday or any time over the weekend?
I think on the weekend we were, because we were saturated in the emergency room. But yesterday, I don't recall getting a message that we were on divert.
What happens if like GMH emergency room is on divert and the Guam Regional Medical City is on divert?
Well, we have to accept the patients, and we alternate with GRMC. We communicate very closely with the EMS, the ambulance team, and depending on the conditions of the patients, we can accept them in, and we alternate with GRMC. And we do have that Care One. That was the original COVID unit where we receive PUI patients. We also then utilize that as an overflow if we need to. And, working with the doctors very closely, that in their assessment, in their medical examination of the patients, if they need to be, discharged home or to be admitted, then we move them into another area. So it's an ongoing process, continuous process, examination of those patients. If they can be moved somewhere else or discharged home, then those are the things that we do on a regular basis.
How serious, though, with these rising cases of COVID-19 positives, how serious on a scale of 1 to 10 is the situation at the Guam Memorial Hospital, 10 being the most serious?
Well, it's a serious, very serious. I can't really give it a number right now because we do have, some capacity where the doctors are looking at discharging some of these COVID patients, releasing them to either the government-sponsored isolation facility or even to discharge them home. And so it is very serious, but we are on it. We are on top of it. We are constantly discussing what other options do we have. I'm meeting with Superintendent John Fernandez to discuss mobilizing some of those school nurses to help GMH. They are already also helping public health with the contact tracing, excuse me, and surveillance. We're going to be meeting with the surgeon's cell later today and with a private clinic, within the community to see how we can tap on their facility and their nurses. And so we're constantly exploring. We submitted requests to the federal government of the medical assignment, to see if we can get some critical care nurses and critical care doctors deployed to Guam. So we're constantly addressing and working these, options for Guam. For Guam's healthcare
Right.
system.
Yeah,
So,
Dr.
we're
Cabrera, he did say that last week that the ask was made for medical personnel last week. Have you guys gotten a response though since then?
we just submitted ours yesterday. We completed the document, so we submitted it yesterday. So, that's going to take a while. And I know the governor's been in communication with Admiral Minoni, and so, we're working with them to help us out, help the whole island, the healthcare system. So,
What's the turnaround though? I mean, what can we anticipate? You made the ask officially in writing. Are we looking at 24 hours or a week, a month?
I can't say, but I'm hoping 24 hours. Yes.
Right. Maybe you should just spam them and just keep sending it over and over and over and over.
What about the and I know I always ask this, the chiller? You said the National Guard was going to help assist to get the chiller over there at the SIF SNU.
Right.
Did they fix it or?
Well, the National Guard did their assessment, and even with our own team and a professional engineer, they did an assessment last week at the site of the financial institution that's donating the two chillers. And, it's going to take quite a bit of time and effort. It needs a huge crane to get the two chillers out of there. In the interim, we published an RFQ last week Friday for an immediate temporary chiller to then be brought over to the SIF. So hopefully the vendors are going to do some site visit today. They're going to if they're going to be given opportunities to ask questions in order for them to complete their proposal. We want to see their proposal by Friday, and then we will select the most cost efficient, cost beneficial, economical proposal. And hopefully by next week, we will get an immediate temporary chiller to SIF so we can get it occupied by patients and by individuals who need to have isolation in that facility.
Right. Yeah, and
So
maybe if you
the
could
plan.
just explain just briefly why it's important to have the SIF and the SNU up and running so Chris doesn't roll his eyes every time I ask
What?
about it.
I didn't even roll my eyes. There was something in there.
You roll your eyes? I saw you roll your eyes.
I was looking up.
No, I mean this really is an important facility to
Yeah.
have up and running.
Absolutely. Very important. And we've been wanting it to be up and running. Unfortunately, it's out of our control in terms of this chiller. Like I've mentioned before, the chiller that is there and has been there for 25 years, it got repaired and it is operational and it is keeping the facility cool, but not cool enough that when we bring in patients, it's just going to get really warm. And so we want to make sure that it's cool enough at a temperature where the patients will be comfortable. And so it is very important because, as we fill up here in the acute side, we want to be able to at least discharge those individuals who still need to have medical, monitoring or medical observation in an isolated facility. So it will free up some of our beds here to then be able to accommodate more individuals who come in.
Lillian, what's it like for your nurses when you have a 7-year-old, you have a 7-month-old, coming in as we see this spike in cases, as we see that it's reaching from Inarahan to Jigo as we see Sabrina Salas Matanani reading off the list of government agencies where we've seen positive COVID-19 cases, and it almost sounds like she's reading the whole phone book because it's just so widespread. So these nurses, right, and we've all been to the hospital, they run the gamut from the young nurses with the young kids who probably are seeing these kids coming in with COVID. I mean, I don't even know what that does to their mindset. And then you've also got the elderly nurses who maybe themselves have pre-existing comorbidities. So what's it like for your nurses? I mean, we talk about the front line, but again, let's revisit the risk that they're reminded of when we see this surge of patients coming into GMH.
Okay, that's a loaded question, and those are good questions, but let me try and answer it. In terms of what's it like for the nurses to see these young individuals, 7 months old, 7 years old, or, even any individual, but the young especially, it's heartbreaking. It breaks our heart, but we got to do our job. The nurses do their job as best they can. And so, it's just something that in our profession as nurses, we have to deal with. And so we deal with it. Those individuals or those nurses, like you mentioned, as far as with comorbidities, we try and accommodate, because of course they're concerned for their health and their safety. And so we try and accommodate and assign them somewhere else where they're not going to be at a high risk. The other nurses, we continue to provide them with lodging to accommodate them and provide them that additional layer of safety and prevention of, bringing whatever it is that they may be in contact with this COVID, virus, another layer for them to protect their family. So we continue to provide them that lodging. Did I answer all that you had asked in that question?
Yeah, pretty much.
Yeah.
I mean, is there
It's,
anything you
it's
want to?
still just got to be hard.
Yeah.
I mean, you're not only dealing
Yeah.
with the patients that are coming in, and I say this because it just kind of escalated for me and went up like 1,000%. That parents now, and I'm sure nurses are parents too, and even the physicians that are having to deal with this online learning and the distance learning, it adds so much more stress. You're laughing at me, but it's true. It is so true. You see me every day. I can just imagine them having to go to work and working these 16-hour shifts or whatever it is over at GMH, and then trying to help their child with their homework. I don't know if anybody's watching on the Facebook live stream and you feel me, please,
Yeah, that people feel
because
you.
it's stressful.
Yeah. So Bree's up for Teacher of the Year. I think she's going to get nominated.
There's always opportunities to do the teaching different ways.
They're always hiring, right, Lillian? Lillian, these are the highest numbers, right? It's just we've maxed
These
our
are the
hospitalizations,
they're
right?
and they're more critically ill.
Right.
These individuals that are coming in are really more critically ill, and so, we're just trying to do and take care. And the good news is there was that one individual who was on a ventilator in the ICU, has progressed pretty well, and so that individual has been taken off the ventilator.
Wow.
So there's progress, and
Right.
yes.
And
Lillian, sorry, I wanted just to follow up. Sorry, Chris, on that. The two patients in the ER that are in the isolation rooms. How many isolation rooms are in the ER?
We have two that have the negative air pressure, that we can then contain and isolate these individuals. So those are the two that we're using right now. We also have in the care one area a secluded isolation room that was, created for the Ebola outbreak, and so we have that additional isolation room.
So say we have 3 COVID positive patients that need to go to the hospital. Where are they going to go, and how do you isolate them from each other?
Well, we're going to then have to really open up the care one. Like I said, there is that one room that is isolation, and then the other areas, the other 4 beds in that care one, we can still use it and keep all those COVID individuals contained in that care one area. That area becomes an isolation area. that can accommodate, 4 individuals. Um, 4 additional individuals.
I'm just, how close are you to being at capacity to
Like
take
full,
in
full.
COVID patients?
How close are we?
Yeah, to being.
We're close, but we're also processing those patients who can be discharged home. So, we're moving. It's a very fluid situation. We're constantly, the doctors and the nurses are working hand in hand to determine which ones are stable enough, don't need supplemental oxygen. They can get inadequate oxygen just from the room air. And so those individuals can then be released to home isolation or to the government sponsored isolation facility. And I just want to take this moment to, take this opportunity to just also, plead with the community, because we do have some individuals who are COVID positive. And so when the families are called to come and pick up the individuals, there's so much fear and anxiety that they don't even want to come to pick up their loved one after being discharged. And so we're using our resources to transport these individuals to their homes, because the families are just so afraid and so concerned. But there are ways to then properly and adequately and safely, transport these individuals who are ready to go home and be home, and continue the isolation at home. So I just like to again, put a plea out there that, families, we just need to find a way to help them get over that anxiety and that fear that, they can continue, the individuals can continue the isolation in their home setting.
Lillian, I don't believe that we had the chance to talk to you about the seventh COVID fatality, because of
Okay.
it happened, and then obviously Monday went. So what else can you tell us about that?
The individual in his 30s, was here since July, latter part of July. And the second week that he was in here, his condition deteriorated to the point where he needed to be, intubated, a tube that goes down into his lungs and connected to a ventilator support that would then was breathing for him, doing the work for him, because he was just getting so exhausted, and it was taxing him to catch his breath, to get the oxygenation into his lungs, into his tissues. And so he was on the ventilator for about 3 weeks. He was on the ventilator, and the doctors and the nurses worked tirelessly to keep the individual, well oxygenated through this ventilator. Unfortunately, I guess the infection was so bad, it really affected his lungs quite bad, that he just couldn't recover from it.
Okay, we're gonna give you the closing here.
Real quickly,
Oh, sorry.
I wanted to go back to what you said about asking for a family to be more cooperative. Have you ever ran into a situation where when you had a COVID patient that was ready to be released and you called the family and they were like, no, I don't want them to come home?
Well, it's not that they don't want them to come home. It's that they don't want they don't want to transport the loved one in their vehicle because of their fear and anxiety of the contamination, the spread of the infection. And so therefore then, we use our medical transport, our resources, to then bring that individual to his or her home, because they want to go home.
Yeah.
And so,
But
yes,
Lillian,
that's where.
if their home doesn't
ahead.
have like the bathroom and the room that they need for isolation, do they then go to the isolation facility?
Yes, and so we work with them, our team, our discharge planning team, ask the individual, are you going to be okay when you go home to then keep yourself isolated? And, they say yes. And so they want to go home. And if not, they're not, if their home is not adequate to keep them isolated from the other family members, then yes, we then get them over to the government sponsored isolation facility.
Okay, I want to just give you the floor in closing. As we approach the end of this lockdown on a Friday, have you heard anything, Lillian, about it being extended?
I have not heard, but you know what? I agree if it does get extended, because look at the numbers. the numbers continue to increase. And our situation here at the hospital, we continue to be challenged with trying to accommodate everybody, and particularly if they are needing critical intensive care unit level of care. And so, it would make sense, and I think it would be prudent, just again for the health and safety of our community, so that we can get people to that level where they can return to work and be productive in wherever that they work. But we just really need, and the students, the school children can go back to school. But we may need to extend it, and I support if it does. Not
Thank
for
you,
my
Lillian.
personal gain, but for the community.
Right. Thank you, Lillian.
Thanks,
Appreciate your
Lillian.
time so much. Good luck. God bless.
Stay safe.
Yes.
Wash your
Take care,
hands.
Stay safe.
Right on.
Yes, wash your hand and your thumb.
Yeah, wash your thumb. Wash your fat.
Oh, okay.
Okay. We could go on and on.